County Board of Commissioners meeting. It's Wednesday, September 24th, 2014. We're in the Senator hearing room at Courthouse Square in beautiful Salem, Oregon, and we will begin our meeting with the Pledge of Allegiance, if you would join us. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
So we have rain, which actually I woke up and heard it and smiled this morning. I guess I'm just tired of all the sunshine.
Smiling in Oregon for rain.
Yeah, it's back. So we always begin our meeting with public comment. We have no one signed up. Anyone want to speak in public comment? All right, then we will move directly to our consent calendar. And I would mention that Commissioner Brentano is excused today. He has higher and better things that he is working on than county business. And
Well-deserved.
well deserved. So Commissioner Cameron, if you would give us the consent calendar.
I'll move the consent calendar. And first item is the assessor, under the Assessor and Board of Commissioners, approve an order approving a settlement agreement with Manatron Inc., Thomason Reuters to receive $713,000 and delegate signature authority to the Chief Administrative Officer. Under Business Services and Human Resources, approve a recommendation to reclassify 2 programmer analysts 3 positions to IT project managers. Approve a recommendation to reactivate, rename, and establish the classification of the County Public Information Coordinator. Approve a recommendation to adjust the pay range of the Chief Administrative Officer, the Chief Financial Officer, and the Project Engineer. Approve a recommendation to uphold the following classifications: Civil Engineer Trainee, Civil Engineer Associate 1, and Civil Engineer Associate 2.
And I will second the motion. Any comments or discussion on any of these?
The Chief Administrative Officer have a comment? No.
He'd prefer probably not to comment. All right, so all in favor of approving the consent items, say aye.
Aye.
They are approved. So we have just one action item today, and then we have a public hearing scheduled at 9:30. So we will move into our action item under Business Services, and this is to consider the recommendations by the Health Insurance Study Committee to adopt an adjustment to the HSA employer contribution and changes to the Kaiser HMO health plan. So Justine Flores here to explain what all that means. Good morning.
Okay. Good morning. So I'm here to present to you and ask for consideration of approval for the renewal of our current health plans, along with some changes that were recommended by the Health Insurance Study Committee to the Kaiser HMO program. There is one change that is a regulatory change to the MODA administered consumer-directed health plan, and that is an increase to the annual deductible that is incorporated in the renewal on the MODA program. First of all, the Kaiser HMO plan, following some discussion and negotiation with the Kaiser program and the Health Insurance Study Committee, some changes are recommended to that program in order to reduce the original renewal that was presented to Marion County. The changes to this program include the following: change from $150 deductible annually for certain services to a $500 deductible, an increase to the annual out-of-pocket maximum from $600 annually to $3,000 annually, or I'm sorry, from 3,000 individual, to 3,000 annually. And then adding a third tier to the pharmacy benefit, which would add a tier in there to include items that are non-formulary or specialty drugs at a $50 or 50% co-insurance to a maximum out-of-pocket per prescription for the member of $100 per prescription. The other adjustment we'd like to make that is to adjust the health savings account, or HSA, employer contribution in order to maintain 50% of the corresponding deductible, which is for the consumer-directed health plan that I just mentioned, the increased deductible there. So to increase the employer contribution to include or to maintain that 50% level is the other change that we'd like to make to the program. And that would, I'm sorry, I lost my spot. That would increase by about $1,000, $1,525 over the 2014 program. So that would total $120,900 for the 2015 plan year. The additional changes that I mentioned before would increase the overall health plan by about 3.6% over the 2014 rate, or $354,227. I did provide for you in the materials 2 spreadsheets that outline those the cost of those changes. The one does outline what it would cost to renew the programs with no changes, and the other if we were to incorporate the changes that were just outlined.
Thank you, Justine. So let me just, for if people are listening and kind of wondering what all the technical
Right.
talk is about, Marion County provides health insurance as a benefit to our employees. Every year from January 1 through December 31, we have a plan. The providers of health insurance, I guess they provide bids or whatever, right, to the county.
Correct.
And the benefits people take a look at the bids. And we have a health insurance study committee comprised of management and labor that get together and actually look at all the technicalities of the bids. Marion County has established a dollar cap that per employee per month dollar cap that we don't want to exceed. So if we were to just take the same plan every year and move it forward, we would have well exceeded the dollar cap because healthcare costs are rising. So the trick is to try to make adjustments to the plans in order to stay within the dollar cap but still get the maximum amount of health benefit that we can for our employees. So we also have a number of different unions and bargaining organizations. Some are strike prohibited, like our law enforcement association. So their plans are a bit different than for the other bargaining units that are not strike prohibited. And we do that through our bargaining process. And then I guess the other thing I would add is that we try to give a menu to our employees depending on their different situations. So we added health savings accounts. I'm trying to remember, it's probably about 10 years ago that we added them as an option. We do have a Kaiser HMO plan, which, as you explained to us on Monday, is getting more and more expensive. And then we also have MOTA that came in for more of a kind of a private fee-for-service type of insurance plan. And we have dental and health and vision, and there's mixtures of how those go. And I think we've always tried to give one option to our employees where they wouldn't have to participate in the premium and pay out of pocket. And we do continue to have that with this new proposal. I mean, when I looked, there were still a couple that were no dollars out of pocket to the employees.
Correct.
But depending on what they want, they may have to participate in the premium. And then, as you mentioned, the deductibles have gone up in some instances, and the out-of-pocket maximums have gone up in other instances. So it's kind of a 101.
Correct.
Why we're
employees
doing this.
do have the choice of mixing and matching the medical and dental. So for example, they may choose a medical plan under MODA and then choose a dental plan under Kaiser, or vice versa, or they can stay consistent. And that is where it affects whether or not they have some kind of a premium share.
Right. Okay, so do you have questions on this? We did spend some time on Monday going through it.
Thank you, Madam Chair, and Justine, thank you, Madam Chair, and Justine, thank you for your presentation Monday as well as today. Just a couple things. So there is a potential, depending on which plan an employee is, that their premium that they contribute will go up?
Correct.
Okay. But also-
Currently in 2014, none of the combinations required a premium share by the employee because everything fell underneath that cap for employees. Even with the changes, there are some of the options this year, or in 2015, that would require an employee contribution.
Yeah. Just an observation. I mean, it's very difficult to keep these costs down for employees as well as for the taxpayer that's paying these bills. So good job on trying to find some solutions to help minimize the increases. Thank you very much.
Thank you.
Appreciate it.
Yeah, our people in benefits for business services have done just an incredible job. I tell the story over and over, but the first year that I was here, I can't remember, it went up like 13% or something like that, and then the next year was like 30% of the amount of cost increases have been humongous. And so we have really worked hard to put some policies and protocols in place, and also the negotiation that you talked about, to go back to the providers and say, this isn't going to work for us, and to use the leverage of having a large employee base to be able to try to get the best that we can for our employees, but still keep costs at a reasonable amount. And some people may not think that, what is it, 1,346, is that the cap?
Yes.
Dollars?
Yeah, that's the
Per
current cap.
employee per month is, I mean, that's a fairly significant number. So it costs us a lot in Marion County to provide health insurance. All right, so you ready to make the motion?
Madam Chair, I'll move that we approve the recommendations by the Health Insurance Study Committee to adopt the adjustment to the HSA employer contribution and the changes to the Kaiser HMO health plan as presented.
I'll second the motion. And John, did you have a comment?
Madam Chair, Commissioner Cameron, when I came to the county many long years ago, we had no cap.
Right.
And with health insurance costs skyrocketing, we really had to put that in. Unfortunately, under Public Employees Collective Bargaining Act, it makes it impossible to move backwards, so we really couldn't reduce it, so we soldered it in where we could. But one of the things we did do, and I think it's paid great dividends, we created a wellness coordinator that has worked very hard to get people to quit smoking, lose weight, and take care of their health. And it has really done great work for us. And we've had, now 2 years without increases in MODA?
Yes, we have. And I'd like to add that that does come into play when we're negotiating with the healthcare providers. When they come forward with increases based on experience, which is essentially the claims paid, we are able to remind them that we are doing a lot here at the county to help encourage our employees to remain healthy and ultimately reduce healthcare costs as well as quality of life for healthier employees.
Mm-hmm.
Okay. Thank you.
So that's an important part of what we do to try and keep our costs down. Unfortunately, they're still very high.
Yes, and we do appreciate the support of the Board of Commissioners and management at Marion County in supporting that program.
Thank you. So we have a motion and a second. We haven't voted yet, right? Correct. All right. So all in favor of the motion, say aye. Aye.
Aye.
All right. It's approved. Thank you.
Thank you very much.
Madam Chair, if I may just make a comment. I have my soft tissue roller in my office from Beth. And, and I made myself a personal challenge when I got here that I would not gain any weight and actually have reduced some pounds. So
Well, good for
working
you.
hard at it. And she's been part of that encouragement.
She is great. Thank you. So we have a public hearing, but it's not noticed until 9:30. It's just after 9:15. So board want to take a little break here until 9:30? Unless you have something else you want to
Just
talk
recess.
about? Yeah, we just recess.
Okay.
Good?
That's
All
good.
right. So we'll recess until 9:30. So it is 9:30. We are back. This is a public hearing. We're going to open a public hearing to consider granting an exemption to allow an alternative competitive process for the jail HVAC remediation project pursuant to Marion County Public Contracting Rules. So we'll start out with Camber Schlag. And Camber, do you have someone with you? It says Bruce Armstrong, but that's not Bruce.
We're still under recess.
Oh, Bruce might be in the traffic. Okay. So if we have any legal questions, Gloria, I think you're on deck, right? All right. That's correct. Thank you. So we're opening this up as the Contract Review Board. So good morning, Camber.
Good morning. Okay. My name is Camber Schlag. In the Finance Department, I am the Contracts and Procurement Manager. And with me, I have Larry Tilford, who is the Facilities Manager in Business Services.
Thank you. Hi, Larry.
All right. Marion County Business Services Department Facilities Management Program has been authorized by the Board of Commissioners to proceed with the jail HVAC remediation project for the Marion County Jail. The county has entered into a contract with Solark Engineering and Energy Plus Architectural Consulting for architectural and engineering services. The county's public contracting rules require the use of the traditional invitation to bid on public improvement contracts. Marion County Public Contracting Rules, Section 40-06102, identifies a request for proposal as an alternative contracting method. The Board of Commissioners may authorize alternative contracting methods as an exemption for the public improvement projects when justified as prescribed in the Public Contracting Code. The county has identified the RFP solicitation method as the best option because of the critical nature of the work, which requires a greater emphasis on the general contractor's experience and technical ability. The evaluation criteria will be based on assessing the proposer's ability to do the project and meeting the time demands of the project. The proposer must be available to perform the work when the inmates are being relocated within the jail facility. The RFP process allows the department to select the firm best suited for the project based on these and other factors, such as past performance and pricing, not solely on lowest bid. Oregon Public Contracting Code, as set forth in the Oregon Revised Statutes, ORS Chapter 279C, allows the use of competitive requests for proposals for public improvement contracts and provides flexibility in both proposal evaluation and contract negotiation under specific conditions and when authorized by the local contract review board. ORS 279C.335 also requires the county to hold a public hearing before approving the findings. The county gave public notice on September 9th, allowing the 14-day notice period, and has received no comments. The findings for the use of the RFP for a public improvement must demonstrate that it is unlikely that exemption will encourage favoritism in the awarding of a public improvement contract or substantially diminish competition for public improvement contracts, and the awarding of a public improvement contracts under the exemption will likely result in substantial cost savings to the county or the public. For public improvement projects, agency findings must address additional factors which are included in our findings, and some do not apply. And you will find those in your packet. The request for proposal will be publicly advertised to ensure a fair, open, and competitive process. The jail HVAC remediation project RFP process allows the county to select the firm best suited for the project based on factors such as experience with secured facilities, meeting schedule demands, the ability to respond to the technical complexity, the unique character of the project, past performance, price, and other factors. The jail HVAC remediation project RFP will include special requirements pursuant to state and local public contracting code to ensure fair and open competition for any subcontractors or subconsultants. The public improvement firm must follow procedures subject to the applicable state and local public contracting code for soliciting, receiving bids, and awarding any subcontracts. The resulting contract from the RFP alternative procurement process will be treated as a contract for public improvement as defined by Public Contracting Code and will be subject to all requirements for public improvement contracts, including but not limited to hours of labor, retainage and payment, subcontractors, bonds, insurance, warranties, peer reviews, as well as prevailing wage requirements. The use of the alternative contracting method will benefit the public by providing a construction methodology that results in the most likely opportunity to acquire a specialized, technical, peer-reviewed, and cost-effective solution for the jail HVAC remediation for the Marion County Jail.
Larry, did you want to add anything?
I don't. I just want to clarify. I think that we support this approach strongly. We believe that it will give us the most qualified candidate at the most cost-effective solution to the problem.
Right, so the alternative to this is we just go by lowest bid,
Lowest bid,
correct?
that's
And
right.
so this RFP, request for proposals process, allows you to set various criteria and then evaluate the proposals on the criteria, not just on the bid amount.
Exactly.
Kind of in a nutshell what we're doing here today. Okay? Anyone else that you had with you that you wanted to present today? Tad, did you want to say anything, or are you just here for moral support? Okay, great. All right, and the sign-up sheet says that no one has signed up to testify. Is anyone in the room wanting to testify? I'm looking, I don't see anyone jumping up and down, so did you have questions for
Yeah, thank you,
Campbell or
Madam Chair.
Larry?
And just, I can't imagine how you proceed with a project like this when you've got tenants in the building that you just can't move anywhere. So it must be pretty complicated, and, thank you for whoever's going to supervise in making sure that we have security all along the process, as well as a air conditioner or heating building.
Right.
Sounds like a challenge.
It's going to be a challenging logistically to make it happen, but fortunately we have a vacant pod right now that we can,
Or unfortunately.
or unfortunately, that we could use to implement the process. So it'll get things going.
Okay, thank you.
And I see Bruce Armstrong has just joined us. Bruce, is there anything you want to add to this conversation? Since you made the effort to come all the way down here, were you caught in the mess on I-5?
Yes, sorry for my delay. No, I don't actually, and I didn't get a chance to listen, but I'm sure, because Camber and I discussed this previously, we've laid out all of the findings that we need to, given the current law change, and the findings support the exemption.
Okay, thank you.
Hey, Madam Chair, I will,
We can close the public hearing.
move that we close the public hearing and approve the board order to grant an exemption from the county's public contracting.
Goes on the top of the next contracting rules.
Oh, there is 2 pages. Approve the, Madam Chair, let me just restate the motion. Madam Chair, I move that we close the public hearing and approve the board order to grant an exemption from the county's public contracting rules to allow an alternative procurement process for public improvement by using a request for proposal RFP for the jail HVAC remediation project.
Okay, and I'll second the motion. Any further discussion? All in favor, say aye. Aye.
Aye.
All right, thank you very much. It's approved.
Thank you.
And that concludes our business for today. I will go ahead and read the Wednesday to Wednesday calendar. These are meetings where the 2 or 3 commissioners will be present between September 24th and October 1st, 2014. So we just concluded our board session here today, Wednesday, September 24th. Friday, September 26th at 7:30 a.m. is a Job Growers Board and Mid-Willamette Jobs Council meeting at Chemeketa Center for Business and Industry, 626 High Street Northeast, room 203 in Salem. Monday, September 29th at 8:30 is the Commissioner's Calendar Review. That is held in the Silverton Conference Room here at Courthouse Square on the 5th floor, 555 Court Street Northeast in Salem, followed by Management Update at 9 a.m., same place. Tuesday, September 30th at 11, we have an Association of Oregon Counties District 6 meeting. That will be held at the Local Government Center in room 113, 1201 Court Street Northeast in Salem. Then next Wednesday, October 1st at 9 a.m., we'll be back here at the Senator Hearing Room in Courthouse Square for our regular Wednesday board session. That will be followed at noon by the Woodburn Marion County meeting, which is generally held at Luis's Taqueria in Woodburn, but it says to be determined because I think they haven't got confirmation yet of the place. And then at 4 o'clock on Wednesday, October 1st, is a community education forum, Marijuana and Our Youth. That will be held at the Kaiser Civic Center, 930 Shamawa Road, Northeast in Kaiser. And in the evening on Wednesday, October 1st at 7, from 7 to 8 is a candidate forum, which will be held at the Salem Public Library, Laux Auditorium, 585 Liberty Street, Southeast in Salem. So anything else for the good of the order?
Busy schedule.
Busy schedule. And rain to do it in, so I hope everybody's smiling out there.
Thankful
So
for
with that, we will adjourn.